Welcome to Healthy Frontiers. My name is Dr. Bizzoni. This show is dedicated to the education of our viewers. The topic for tonight is living with a healthy heart. My special guest is Dr. Ivan Hernandez. Dr. Hernandez is a doctor of physical therapy with a degree from New York University. He also has certifications in orthopedic and sports physical therapy from NYU. He's a clinical instructor for New York Medical College's DPT program. He's working on his first book entitled Courage to Continue. In 2017, Dr. Hernandez will launch several programs including Move More, Live Longer campaign, a weight loss program, and a video series. Dr. Hernandez continues to work with pro athletes and celebrities. Dr. Hernandez's life changed dramatically when he suffered a mild heart attack, yet he transformed his pain into productivity, and he will share this with us tonight. So I'd like to welcome Dr. Hernandez to the show.
Thanks for having me.
Welcome, Doc. Okay. So, Doc, why don't we start off with this life-changing event, which is when you had this heart attack?
Yeah, sure. It was in May of 2017. It was an ordinary Friday. I had completed a full days of work. I had gone to the gym, had dinner afterwards, and that evening I had some indigestion, at least I thought. I thought nothing of it, went to bed, woke up the next morning, and this indigestion that I had escalated, and immediately there was this feeling of impending doom. Sure. So I called my brother, who's a nurse practitioner. He advised me to go to the ER immediately, but I didn't listen to him. Mm-hmm. I said, you know what, this is just indigestion. So I went to a local CVS, and prior to that, there were a series of pivotal decisions that I had to make, but ultimately I ended up in CVS. And at that point, the symptoms had gotten so bad that I remember drinking antacids in the aisle and an employee asking me if I was okay. Mm-hmm. So it was very surreal, how it happened. But as I exited CVS, there happened to have been an urgent care clinic just across the street, a clinic that I had visited just 2 days prior for non-clinical reasons. There were business prospects. And so here I am 2 days later. Right. I see the urgent care doctor who I met just 2 days prior, and he did an EKG, and lo and behold, I was having a heart attack. He said, you're having a heart attack. Wow. So it was very surreal.
Oh, for sure.
Yep.
For sure. So how can you recognize a heart attack?
Well, the imminent signs are, arm pain, chest pain, jaw pain. Right. I had this deep gnawing pain underneath my breastbone. So these are some of the classic signs and symptoms. Mm-hmm. This feeling of impending doom. Right. It's hard to explain. You kind of have to,
go through it.
Go through it in order to kind of understand what I'm saying. And then, regrettably, this feeling of denial. I was in complete denial, and this is another classic manifestation of what people experience when they're going through a heart attack. They relegate it to something less grave. Mm-hmm. And I shouldn't have, in retrospect, but, in retrospect, I realized that, I should have acted quicker. Thankfully and fortunately, things worked favorably for myself.
Perfect. So those are some of the warning signs as we just went through, right? Yep. So why is it important to maintain a healthy heart? Let's talk about that.
Well, look, obvious reasons. Your heart is, it's a vital organ. Sure. If it's not working, you'll die. Mm-hmm. But if it's not working properly, you're not functionally optimally. Mm-hmm. So it's important to recognize that heart health is a vital a part of your livelihood. Mm-hmm. The truth of the matter is that it's the number one killer in America. Just last year, there were over 610,000 deaths attributable to heart disease. That's 1 in 4 deaths being secondary to this condition. So it's a prevalent problem. And it's something that we need to address, not so much from a treatment perspective, but from a preventative standpoint.
Sure, and we don't want it to be too late when the signs come and there you are, it's too late. So, okay. So what is heart disease? Let's explain that.
So, heart disease is any pathology, any disease process of the heart. And of the many heart diseases that exist, without question, the number one disease is coronary artery disease, which is when there's clogging in the arteries. And usually it's the result of a number of aberrations in the person's physiology that's been going on for some time. And the heart attack is the ultimate manifestation of what's been going on. So that's why it's important to get blood work and checkups, especially if you have a genetic predisposition, a family history for heart disease.
Sure. Okay, so how does stress affect the heart and body?
Wow. You know,
Loaded question, I know.
You know, we live in a society where we're bombarded with stress.
Yeah.
You know, most people work more than just one job or more than 40 hours. We're negotiating multiple things: family, work, recreation. So it's not uncommon to have stress. And, you know, our body's so fascinating because we're equipped to deal with stress. You know, we have a hormone called cortisol that our adrenals produce in the face of some type of stressful situation.
Sure.
But it's designed to be short-lived. So if I encountered a life or death situation, my cortisol will elevate in order to protect myself, to elevate my nervous system so that I could escape. You know, it puts me in this fight or flight state. The problem is that, and this is unfortunately too common in the American society, we're so overworked that this cortisol becomes chronic and persistent. And as a result of that, our cortisol starts to wreak havoc in our body. Sure. And that's this subclinical inflammation that starts to brew is what eventually leads to a heart attack. So it's important that we look at these blood markers very early on, so that we could prevent it and just identify risk factors as well.
Sure. So we all should get checked up regularly.
Yeah,
key factor.
Absolutely, right? Especially if you have risk factors. It's even more the reason to look at these blood markers.
Right. So what about smoking and excessive alcohol, even, you know, just a little too much alcohol?
Yeah.
How does that play in?
You know, that is, you know, unequivocally the case. We know that if you smoke, we know that if you drink alcohol excessively, that it's going to increase your risk for heart disease. And fortunately, people are smoking less. That's what studies show. We are smoking less because there's more information. However, that's been substituted with a new risk factor, a modifiable risk factor. That's sitting disease. Oh. Sitting is the new smoking. Yeah. You know, scientists now have put together a number of studies that show that 5 hours of sitting is the equivalent of a pack and a quarter cigarettes. Huh? So we're doing ourselves harm by just sitting all day. You know, the average American is sitting arguably up to 15 hours a day. So of course you got to nix the bad habits, the alcohol, the excessive alcohol, the tobacco use, but we also need to start moving more. Right. We are in a very sedentary society, and this is why I named my campaign "Move More, Live Longer." Right.
Love that.
Yep.
Yeah. You know, just as an aside here, you know, in corporations now, you see they're giving stand-up desks so people aren't sitting as much.
That's right.
They're starting to get the message, I think, more than ever, you know.
Sitting causes stress. Sitting causes inflammation. Sitting increases your risk for diabetes and hypertension and all these things. Right. So it's something that we need to address. But you know, there are a number of risk factors. That's simply just one of them.
I understand. Sure. Okay. So what are the 5 pillars of optimal wellness, according to Dr. Hernandez?
So I developed 5 pillars of wellness that I use to transform, help people transform into their optimal versions of their selves. And these 5 pillars are evidence-based. So what does science show? Science shows that if we have a diet, for example, that's full of high fructose corn syrup and hydrogenated oils and excess sodium, that we're going to develop conditions, a number of conditions, metabolic syndrome particularly, which leads to obesity and hypertension and diabetes, all of that. So diet is important. I'm a proponent of healthy fat, lower the bad carbs, and eat rich quality protein. The second one is exercise. We need to move more to live longer. So I often tell people, use a pedometer. Most smartphones have a pedometer, and you got to be walking at least 5,000 steps per day. Anything under that would qualify as being sedentary. And then the last 3 aren't so obvious. That's stress. You know, the average cost of corporations per employee is $1,600 on stress-related illnesses. That includes heart disease. So there's a monetary factor as well as the physiological factor that stress has. So it's important to address yoga, deep breathing, meditation. Those are all very good interventions to manage our stress on a daily basis. Sleep, it's become the new pillar of health. We know that when we don't sleep enough, it increases our risk for these preventable diseases. So we need to be sleeping at least 7 to 9 hours. And in my transformation program that I offer to my patients and clients throughout the world, I'm going over these pillars. And the last one is the outlook. You need to have a positive outlook. Look, we're bombarded by stress. We're bombarded by toxicity. That includes even people. So there are things that we need to remove from our environment in order to optimize our transformative process. And having a positive outlook is key. You know, if you look at people that join the gym in January, less than 10% of them are going to be committed for the entire duration of the year. And that's because their outlook, they don't know what to expect. They don't know the process that they have to go through. So that's the first thing that I discuss in my transformation program, and I offer education via webinar.
Great. So what are some of the exercises that prevent heart disease?
Well, first of all, you know, when it comes to exercise, there's distinctions between physical activity and exercise. Number one, as I alluded to earlier, we need to simply move more. We need to get off our butts. So at least 5,000 steps. But in terms of exercise itself, brisk walks, 10-minute walks 3 times a day is great. Running, cycling, swimming, these are all great activities. I'm personally a proponent of strength and conditioning because you get a big bang for your buck. Not only when you do strength and conditioning exercises, not only do you work your limbs and your core, which are peripheral adaptations, but you also develop central adaptations, your heart namely. So it's a great exercise for your heart, for your core, for your limbs. And then what it also offers that other exercises don't always offer is it provides a metabolic effect. So, and a hormonal effect. So you have elevated metabolism when you do strength training. You have increase in anabolic hormones that are responsible for fat loss and muscle gain, and it improves cognition. There's so many benefits. It's just, it's a very long list, but you know, I think any one of those are suitable. I personally like strengthening as a means to stay fit.
So when someone comes into your terrific clinic, I mean, I'm sure you evaluate for that and find out what's going to be best for this person, and then set them on a program, a protocol. That's you know, that would be best for that person because everybody's so different, right? So I think that's a great general rule, and I certainly agree. And I think that and I know in your clinic you take that a step further and really work with the client one-on-one.
That's right. I try. Absolutely.
Great. So you write about belly fat a lot. Well, how is that? So how's that linked to heart disease? So, you know, when somebody has a gut, you know?
So, you know, I mentioned earlier this condition called metabolic syndrome, which is 5 aberrations that you see in people that have a high risk for developing diseases. And one of the criteria is having a waist greater than 40 inches for a man or greater than 35 inches for a woman. And this is linked with a number of diseases, heart disease being one of them, because it's associated with visceral fat. So when we have fat around our belly, it's indicative that there's fat also in our internal organs, as opposed to what we refer to as subcutaneous fat that is not as alarming. Although body composition is important to consider, if I had to pick one of the two in terms of having, I would choose to have subcutaneous fat as opposed to visceral fat.
Okay, so that's going to dictate you may get fat around your heart or some other area, some other important organs.
That's right.
Okay,
that's right.
Good. So obviously the next question is why is weight loss important in general?
You know, weight loss is important because it's associated with longevity and decreased morbidities, less diseases. And again, these are all the diseases that are very common. Heart disease, diabetes, hypertension, Alzheimer's, cancer. There's so many of them, and it's directly linked with weight. But UCLA put out a number of studies a couple of years back, and they looked at weight. And while weight is important to address, it doesn't give you the whole picture. So it's important also to look at body composition, waist to hip ratio. BMI is more of a crude formula, but when you look at body composition and waist to hip ratio, you get a better idea of what exactly is happening. If I were to look at my BMI, for example, I would be considered overweight.
Right.
And I'm not. And if you were to look at, for example, a LeBron James, for example, he would be considered overweight. Sure. But if you look at his composition, it clearly indicates that he's very healthy. So these studies that UCLA put out shows that while weight is a factor, body composition gives you a better picture of what's happening, not only on the outside, but on the inside, and your tendency to develop these conditions that are preventable.
Right. Great answer. Yep. Okay, so I understand you launched the weight loss program, right? So
yeah.
What is that all about?
Well, I'm excited about this.
Yeah.
I'm really excited about this because it's accessible to people worldwide. Prior to my heart attack, for the most part, I worked with people within the walls of my office, but my plight kind of created a launching pad for me to help people throughout the world, and that's why I created a transformation program. And it's not so much a weight loss program. I would say primarily it's a health transformation program.
Okay.
What I'm trying to do with my clients is I'm trying to get them healthy, and the way I qualify healthy is by improving subclinical inflammation. These are little indicators that show that there's inflammation and disease processes brewing at a cellular level. So I get them off of the junk. I get them off of the high fructose corn syrup and the sodium. I get them off of the things that are going to create disease inside the body. And I also give them an exercise program, and I take them through the 5 pillars. And it's a very effective program in terms of creating optimal health. As a result of that, people lose weight. Yep. So my first purpose is to get people healthy. As a consequence to getting healthy, the fat comes down. Right. I don't want to promote in this transformation program weight loss directly, because the problem is if you chase calories, anyone could lose weight. I could eat 1,000 calories of McDonald's a day and arguably lose weight. But is that healthy? Right.
That's a great example.
Yeah.
Great example. So, okay, what is your book, Change to Continue, about?
Courage to Continue.
I'm sorry, Courage to Continue.
Yeah. Well, I'm excited about that as well. It's my first book. It's going to be published in May. It'll hit the shelves and it'll be available to the public in May of 2017. I'm currently doing a book tour throughout the States.
Wonderful.
So I'm excited about that. But the book is about the 5 pillars of wellness, what I discussed: the diet, the exercise, the stress management, sleep, and then having that positive outlook. And I'm using these pillars, and throughout the book, I'm giving my own personal and financial and business challenges that I've had and how I was able to persevere by employing these pillars into my own life. So I think it's a great book for any reader who's looking to improve their lives, to develop hope, to establish perseverance, a pragmatic way to persevere through challenge. And it's evidence-based. It's evidence-based as per the literature, but it's also evidence-based as per my own personal experiences, as per my life.
Right.
And fortunately, I am the healthiest that I've ever been, and I attribute that a great deal to modifying my lifestyle.
Sure, and especially, okay, so you had the heart attack. There's a great book called The Obstacle is the Way.
Yeah.
And there you go. I don't know if you're familiar with it, but it's a great book.
That's an old ancient proverb.
Yes.
The path is through the obstacle itself. So yeah, yes. I believe in that. I believe that, I was faced with this crisis, but I didn't let this crisis go to waste. Right. I made something of it, and I enhanced this negative experience to helping the world. So, in retrospect, I actually don't regret it. It sounds odd, but I don't regret what I went through.
Yeah, well, that's great. So when does your Body Remix book and boot camp tour start?
It's already begun.
It's begun.
It's
Good.
begun. We started last week. I was on a few television networks discussing healthy heart awareness, also discussing my book. I'm here now discussing healthy heart
Great.
with you,
So
but
glad.
also discussing my book as well, yeah.
Yeah, great.
So I'm excited about that.
Awesome. So take me through last 5 minutes or so here. We're going to talk a little bit more about it. If I walked in your office, what happens?
Well, you know, upon entering the exam room, we would first and foremost look at your history. You could get so much information just by history alone.
Right.
You know, you want to look at, was there trauma? Is there something, or is there cumulative microtrauma, which is in fact more common? Is there something that you're doing throughout the course of the day that's causing this pain? So we look at the whole gamut. You know, we look at, was there a particular incident, or are there small little incidences that are building up and creating this problem that you're walking in with? And then we go on to the physical examination, where I look at the pathoanatomy itself. So if you're coming in for the knee, I'm looking at the knee. If you're coming in for the back, I'm looking at the back.
Right.
And then I take it a step further and I look at it from a more holistic global perspective. So I look at the local pathoanatomical region, but then I look at the global movement pattern. So how is the person moving relative to that specific diagnosis? And that gives us a better picture of actually what's going on. Because oftentimes you're moving in a funny way, and people don't realize when they're moving in a funny way. And it's usually a movement therapist, particularly physical therapists, chiropractors, they have a keen eye to analyzing movement. And you could pick up these little subtleties and determine why that knee problem began in the first place.
Right.
So we look at multiple things, and then, you know, and then we treat that pathoanatomy, but then we also treat those aberrant movement patterns.
Right. I mean, we talk about the kinetic chain a lot in the office, right? You know, it starts in your toes and your feet, and then right into your knee. So, I mean, it could be a back problem in my office, and it's really starting from their feet or their knees, right?
Yeah,
so,
that's right.
I mean, I'm sure that's what you're talking about there.
Yeah. So it's treating the problem that they're coming in with, looking to remediate their problem, working on movement, and then I bring them towards wellness. And that's why I offer the programs that I do, the transformation program. I do boot camp classes at the office that I actually instruct. It's fun. I have a fun time doing the boot camp classes in the office. And then everything else that we're doing, you know, just really I engage, you know, I look forward to engaging with patients every day, you know, having dialogue about what a healthy life is.
Right.
Because if you just treat the problem, it's more of a symptom-based intervention, where I'm more of a proponent of more causation-based interventions. So what's causing it, and let's treat that.
Right.
And also, let's not forget what you're coming in with.
Correct. No, it's not just patch it up and
Exactly.
You know, let's find out why you have it. That's great. Do you see that you treat some kids? I see my office. I love when the parents come in and they say, you know what, maybe I should have my kid checked, you know, because and then when they're the example for the child, you know, so we encourage that all the time. Do you do the same?
Yeah, you know, we see the full gamut, you know, the entire developmental ages from pediatric to geriatric. You know, it's really not any different when you're looking at the pediatric population from a musculoskeletal perspective. You want to look at the way they move. You want to look at why they have a problem. A lot of our work is detective work. You know, you gotta you know, pull off these layers and figure out why this thing is happening. So in a lot of ways, it's very similar. We do a movement analysis. We look at the local joint itself. You know, I could tell you that with the pediatric population, what I see commonly is that they especially in today's society, a lot of kids are one-sport athletes year-round. You know, that's a big topic. And so they're developing these cumulative micro trauma injuries. And, you know, what's unique about the pediatric skeleton, their body, is that because they're growing, they're more at risk for these joint problems, these apophyseal problems like Osgood-Schlatter's or Sever's disease, little league elbow.
Yes.
So you know that is a distinction, and you know our treatment, while it's the same, they're different, or there are more precautions that we have to consider when we're treating these joint problems with the pediatric population.
Sure. And, you know, go to that point about one sport. I think the consensus now in the whole medical and alternative world is let's, you know, it should be many sports, you know,
Yeah.
and let's train all the muscles, and let's, you know, the kid will find out what they like best too.
Yeah,
You know?
you have to have a multidimensional approach
Right.
when it comes to remediation, when it comes to prevention and wellness, and you got to look at everything.
Right.
Sleep affects the athlete,
Sure.
stress affects the athlete.
Yeah.
So all these things, the athlete's psyche
Okay.
is going to impact the way one performs. So you want to have as much as possible that multidimensional outlook, and you want to see the patient as a whole and not Mr. X who's coming in for the knee.
Right.
You know, you want to look at Mr. X as a whole and see how everything in his life are possible contributions to his problem.
Great, great. So, you know, I know you're doing this national book tour now. You're all over the country, which is fabulous, and wish you all the
fun.
best with that. But your office is right here in Westchester, isn't it? You mean?
Yeah, it's in Yonkers, New York. It's
Right.
right on North Broadway, just across the street from St. John's Riverside Hospital.
That's great. Very accessible.
Yeah. We've been helping people since 2006, so
Great.
it's fun.
So, any final words before we end this now, Doc?
You know, just look out for my book. I'm excited. This is my first book. You know,
Yep.
everyone that I encounter, I'm telling them about the book. I'm telling them about, you know, I've become a big vocal spokesperson for wellness.
Right.
So I'm teaching them about the book and my transformation program. So, you know, I guess my last words is if anyone is interested, any of your viewers are interested in joining my transformation program to get healthy,
Yep.
and then secondarily to lose weight, they could reach me at my office. It's executiveparkpt.com
Right.
Or 914-509-4640.
That's great.
And I'm
Doc,
also on social media, Dr. Ivan PT.
All over the place.
All over the platforms.
We can find you all over.
Facebook, Instagram, Twitter, all that stuff.
Great. Great. Doctor, great to have
It
you
was
on
a
the show
pleasure.
tonight. Always
Thank
a
you.
pleasure. We look forward to seeing your book, and we look forward to seeing you on the next show. Thank you so much.